introduction, with the emergence of vaccination and availability of vaccine, I would like to quickly go over the guidelines for vaccination in cancer patients. There are multiple vaccines available right now. 3 of them are FDA approved in United States. The 2 are mRNA vaccine from Pfizer BioNTech and Moderna. And in US, J&J, and in the rest of the world, AstraZeneca vaccines use a different technology which carry adenovirus as a vector that carries a viral DNA. So these vaccines are extremely effective. The efficacy of these vaccines are never been seen before in any other type of illnesses, and they are perfectly safe. I just want to make sure that everybody understands that these vaccines do not contain any live virus or the part of the virus. These are synthetic vaccines and do not risk contracting the disease in immunocompromised or immunosuppressed patients. So these are completely safe. There are some side effects that I will discuss later, but overall, these are the safe vaccines and do not cause COVID-19. I cannot stress this enough because even today in my clinical practice, I encounter at least one patient who has not been vaccinated and hesitant to get the vaccine. So I just wanted to make sure that these vaccines are safe. There is a concern that the vaccine may not be as effective. Overall, these are quite effective. The recent data from European Society of Medical Oncology was presented in September 2020, which included a study of over 1,000 patients. And it proved that both mRNA vaccines are quite effective, up to 80 to 90%, which is almost parallel to general population, where these vaccines were almost 99% effective. They looked at the antibody response. They did not actually talk about the COVID-19 disease in these patients. However, there is data emerging to suggest that immunocompromised patients may have limited antibody response, particularly in the patients who actually have hematologic malignancies or getting treatment with monoclonal antibodies that actually work against many of lymphocytes or the markers that actually, or the molecules that improve immunity. So one of such drug is Rituxan. And in patients who have hematological malignancy or on immunosuppression therapy or getting monoclonal antibodies, their responses is blunted. I am actually going to talk about the 3rd dose recommendation. And I think there is some confusion about it. 3rd dose is different than the booster. So the booster of COVID-19 is given after 6 months of the last dose. And that's when it is seen that the immunity from the vaccine is waning and the booster is given to boost the immunity again. The 3rd dose is different because in cancer patients and patients who have impaired immune system, such as after the solid organ transplant, mainly kidney transplant, they have shown that their antibody response to 2 doses of vaccine is not as robust. And after the 3rd dose, their antibody response was as robust as in the other populations. So the 3rd dose is recommended for these patients who may be immunocompromised. And the CDC definition for these immunocompromised population is patients with active cancer who are receiving active treatment, the recipients of organ transplant taking immunosuppressive medications, the recipients of bone marrow transplant within the last 2 years, patients who have primary immunodeficiency syndrome, which have congenital immunodeficiency syndrome, patients who have been on steroid therapy that may suppress their immune system, and patients with untreated or advanced HIV infections. So in these patients, CDC recommends that an additional dose of mRNA COVID-19 vaccine must be or should be administered at least 4 weeks after the second dose of the mRNA vaccine. The current recommendations are for the mRNA vaccine. The data about J&J and the AstraZeneca vaccine is not clear. And right now, the second dose of J&J is actually being recommended, but not completely for the same indication. The J&J second dose is recommended for booster, but not to improve the immunity. So I would say even in the patients who have gotten J&J vaccine, we're recommending to take mRNA vaccine at least 4 to 6 weeks after receiving the last dose of the vaccine. The CDC does not recommend use of antibody titers to determine who should receive the third dose. Anybody who is who qualifies according to the CDC guidelines as an immunocompromised patient should receive the third dose of COVID-19 vaccine. And patients who actually have received COVID-19 vaccine before, but still developed COVID-19, we still recommend third dose of COVID-19 vaccine after they have recovered from it and cleared from the COVID infection. So these are the guidelines from CDC. The vaccine response, even with additional dose, may not be sufficient to prevent infection in the immunocompromised patients. So we do recommend that even after receiving the third dose, immunocompromised patients should actually use caution and avoid crowds, large public gatherings, and limit contact with people outside their household, and especially limit the contact and interaction with unvaccinated individuals as much as possible. So even though vaccines are safe and effective, the efficacy may not be as robust as in general population.